You know, if you go in the community and you look at people, most people fall into one of four body types, okay? And it has to do with where they hold the weight. There's the adrenal, there's the liver, there's the ovary, and there's the thyroid. So depending on what's going on with your hormones internally, we can pretty much predict what you're going to look like. So there are four different types of fat. And if you put everyone on the same program, like a lot of programs out there, there's a lot of books out there that are based on the person's experience, but it might not be right for you or someone else. I have an advantage. I've been in practice for 25 years, worked on 35,000 different people, and I have worked with a lot of different types of people. And I've summarized most people into four categories. For example, if you hold weight in your belly, that is coming from a hormone called cortisol. That's a stress hormone, okay? Yet if you hold weight on the hips, that's coming from estrogen, that's cellulite. Completely different situations. The way you get out of lower cortisol is very different than lowering estrogen, especially with exercise. They're completely different. So what will help some person will actually ruin another. And this is why you have people that will do marathons and they start getting atrophied. The muscles get loose, they don't get tone. So when you hit the age of menopause, what happens in the body is these hormones start really shifting because the ovaries are no longer backing up the adrenal gland. The adrenal gland's on top of the kidney. Now that adrenal has to work twice as hard. Usually a person's at that point kind of burnt out, so it's not going to really back that up. So what happens, they start getting a situation where their lean body mass just falls apart. The collagen falls apart. They get loose skin right here, right here. They get the belly, and then they try to work out. Well, all that's going to do is going to add stress to an already stressed out body, simply because of the cortisol is going up. That's that stress hormone. So one of our goals is to lower that, especially in your belly fat. The programs out there right now, even the ones that claim to help belly fat, never address cortisol. All it is eat this diet or do this diet or exercise this way, but they don't talk about how to lower cortisol. They don't talk about how to pull the stress out. I developed a program that's an acupressure do-it-yourself program that will help pull the stress out of your body. Over the years, all the stress that you've been through, whether divorce, pregnancies, menstrual cycle, upset, injury, infection, pushing yourself at work, being stressed out by all these people, all that has been accumulating. You're like a bucket filling up with stress. And what happens is that stress can act as an open application on your desktop computer. So you have all these applications open on your desktop computer, so everything's running slower. So what this technique will do is it tends to close the applications, Control-Alt-Delete, wipe out the old stress, and get you into a state of a stress-free body. That would really help your sleep. Can you imagine never experiencing stress? You know what that would be like? Never having any relationship problems, never having any pregnancies, never having any menstrual problems, never having any upset. You know what you'd feel like right now? It would be really good. That's what it's like to have the acupressure. That's what helps lower the stress. That's what helps get you in fat burning, especially if you want to target the belly fat.